advice is get Google Slides, get Google Docs, download all of your PowerPoint slides to Google Slides, and every time you type something, or if you um, you type something, or if like let's say you make any edits, you don't have to change it. It automatically saves, so you never have to worry about, oh my god, did I save my notes? Oh my god, did I do this? Oh my god, did I do that? So yeah, Google Slides, Google Doc. So I'm going to show you guys my cardiovascular study guide on my PowerPoint real quick. Okay. All right, I just got to block out the name. So here is an example of a study guide that I created. What I did was I just, oop, the light is so bright. I don't know if you guys can be able to see. Okay. So this is all my notes. I put all the drugs at the top. Um, Gender differences, any cardiac assessments. So you're going to be definitely listening to heart sounds. We know that S1 and S2 are normal sounds. We know that S3 are abnormal signs. I'm sorry, abnormal heart sounds. You're going to be looking for troponin levels. Why? Because that's like an indication of heart failure. CK and MB are also cardiac serum markers, so you want to also watch out for that. The nursing process, like how to go through the system, diagnostic tests. We know about cardiac catheterization. So basically, for this class, I need to also mention that even though you had to know like the body systems and the drugs, you also had to know about the surgeries that was involved with it, any tests and procedures or diagnostics that was involved with it, any labs, let me see, ABGs or anything that's like associated with any system. You definitely had to know that. So I did that for every single system. So I did it for cardiac, did it for respiratory, I did it for endocrine, I did it for what's some other systems I can't even think. Musculoskeletal, I did it for neuro. All those systems, you definitely want to keep it organized because at the end you are tested final, cumulative on all the systems. So that's that. All right, let me go back. All right, so that's the end of MedSurge 1. So that's that. So I'm done with that. All right, so again, another tip for any of the classes that you're in, I would sign up for like nursing, what is it? Like nursing websites or nursing blogs, like where you can pick up diagrams like this of the heart. Now here was another class that I did. Let me see. I'm trying to think. Like hypothyroidism, like little diagrams that will help you just remember, like stuff like this. You see hypothyroidism. Now, if I see this picture and I see like what are some clinical manifestation of somebody who might be going, who is experiencing sweating, finger clubbing, menstrual changes, and it will ask you. Sometimes it won't even ask you for the signs, but it will be in the question. You have to figure out, what system or what disease is associated with it. So that's another tip that I feel like you should definitely have when you're studying for a med surge. Um, so that is that. Next class I want to talk about is maternity, because I already did health assessment in another video. So maternity is a class that we took in the summer, and we took it along with mental health. So maternity for our school was 7 weeks. Mental health, I think, was about like 8 weeks or something. So while we're in these classes, we're also doing clinicals. I was on a labor and delivery floor, and I also did postpartum care, and I also did triage for the labor and delivery unit. And so this is my folder for maternity, and that's another tip too, I would say, is to make sure that you get folders for each class, especially if you get like printouts and stuff like that. So maternity and pediatrics were kind of like intertwined. So we started off with pediatrics. So what I did was for pediatrics, I went online and I looked up like pediatric normal vital signs. Let me see. And then also for labor and delivery, I looked up like flow charts of what we needed to look at when we had an incoming patient or admission. We want to know the room number that they're in. We want to know like also I had to know immunization schedules, but some schools are a little bit different. Like some schools you don't have to, but some of my questions did have that. So for maternity, again, what I did was I created a Google Doc account, created study guides for each. So it was maternity, postpartum, before you get pregnant, pediatrics. You go through all the body systems. I made Google Docs for each of those. The best way I felt like to study that, because maternity for me, I felt like even though I've been pregnant, and that class was kind of hard for me because, again, I kept comparing the answers to my experience. So if anybody's pregnant, I would not do that. I would say, just keep it face value of what you see in a patient, okay? So that's for maternity. For mental health, this class was very interesting to me. Honestly, I didn't really care about mental health, but I'm starting to realize that mental health is seriously important. Same thing with this class. The only difference was that this class you basically study and know how to speak to a mental health patient. You know about the drugs, and sometimes people who have mental health issues, they still have comorbidities like diabetes or COPD or whatever. Might have any other diseases associated with it. So with this class, again, I made sure I just studied like all the diseases, mental health disorders, how to speak to them, drugs, knowing those adverse effects, when they can take it, because sometimes people who have mental health issues also suffer from uh, substance abuse. So you have to be careful about that too. So for this one, my teacher, she created like these little umbrella terms. So tricyclic antidepressants like amitriptyline, and you have like, sorry, chloropyrimidine. I can never pronounce these. So these tricyclics is tricyclic. Why? Because it works on three neurotransmitters. So serotonin, norepinephrine, dopamine, and there's really no diet restrictions. And what I noticed with mental health, there was some drugs that had diet restrictions that you had to definitely know, and those are things that they would test on. For example, MAO inhibitors like I'm just giving out the name, Nardil or Parnate, those are MAO inhibitors. And for this one, you never want to give any of these drugs if along with foods that have tyramine in it. So that would be like aged meats, cheese, wine, sauerkraut, pickled fruit, because that can lead them into hypertensive crisis, can lead to a whole host of other things, like they can have elevated blood pressure, confusion, stuff like that. So, and also you never want to give this to a patient who recently just had alcohol, because that is a no-no. So yeah, that was that. For this class, I felt it was more important in my school to actually review the PowerPoint, but then the PowerPoint was just basically the surface. So for this class, I definitely would say review the textbook. Now, all of my textbooks for my classes, I did use electronic books. The first semester I used regular paper books, so that was that. The next thing is nursing informatics, which is like the beginning of our research course, which is in this folder. And again, that was where I was talking about where you pick a topic that you want to research. I did mine on malnutrition and the elderly population. And again, this book, APA book, was like, you needed to know this book. Like, there was no way that you can pass this class without having this book in your hand, embedded, because the teacher who taught this class, she just finished I think her doctoral program like maybe a year or so before I took this class, and she would take off a lot of points even if a period was missing. So I'm like really stressing this because I don't want people to end up how I ended up in some of my papers. Some people ended up failing papers because they weren't following the APA. So yeah, for this class I felt like was very time consuming because it started in the summer along with the mental health. So you had to do this, you had to start doing research topics, you had to figure out what scholarly articles you were going to use, and it's not something that you can use on like Google. You had to actually use like Google Scholar, make sure that it's APA um, a scholarly, written, research, well-rounded article. It can't be just something that you just Googled and said, oh, malnutrition, elderly. It has to be something that was research-based. So that's that. This class, I forget. Oh, this class I ended up getting an A, I think. And most of the stuff that I usually got points taken off of was because of APA stuff. That's why I'm like seriously stressing it. Like, you guys, if you are in that class, seriously pick up this book, and it's not even that expensive. So, but for me, I'm going to keep my version because I'm planning on going back to grad school, so I'm not going to give it up. All right, so I talked about mental health. Oh, wait, I'm missing one. Community, yes, community, and this one is what? This is so scholarly. Okay, all right, so the next, that was summer semester. So fall semester, which is our last semester. So that is community. We have adult health 2 and our capstone class. Okay, so let me start off with community. Let me tell you my honest opinion about the class. I did not like it because I don't see myself as being a community nurse. For some reason, I wasn't really interested, but when I got into the class and I started figuring out what they actually do, I can really appreciate the work that they do. But I just feel like that was not like for me, like, personally, because it's good, because, I thought mental health was not going to be for me, but guess what? I can honestly see myself working in mental health, so it just all depends. So with community, this class was a little bit difficult because it was a lot of overview type things, so you basically had to remember all your diseases and all your drugs and figure out how to help the patients in the community. For this class, we did go through, let me see, all of the systems, like a little bit. Like say, like if you're in a community and you're working with a diabetic patient, you would need to remember like what you would look out for, what you would need to bring, what you would need to do for assessment. If they needed care, who would you refer to? So you're more like doing also case management type stuff depending on the setting. And that's it for community. Now, MedSurge 5, I'm sorry, I said MedSurge 5. Um, MedSurge 2, which is like the adult health 2, this class was basically a step up again from MedSurge 1. I did feel like this class was still kind of repetitive because we still went through all of the systems again. And I'm looking at my Google Doc right now. Let me get out of this. I'm looking at my old study guide, and the only things that had changed from the first adult health class to the second one was the fact that we covered diabetes more in depth, and also we added immune system more in depth, and then also we talked about burns, and we also talked about ventilation, sedation, stuff like that. And burns, like the rules of 9, like the knowing like the percentages and figuring out if the person has first degree, second degree type burns. Again, I used the same method that I did for MedSurge 1 for MedSurge 2. The only thing was I felt like the questions did get a little bit more harder. They force you to think a little bit more deep compared to MedSurge 1. And we also learned from MedSurge 2 telemetry strips, knowing what ventricular fibrillation looks like, atrial flutter, the diseases that can cause it, things that you would do to prevent it from happening, things that you would do while it's happening. And that's pretty much it. You still had to know all the drugs that was associated with it, the diagnostics, procedures, things like that. So the same method I use for MedSurge 1 is actually the same method I use for MedSurge 2. And then, let me see, is that it? Capstone. So Capstone is the last class. Basically, this is the class that you would do for your final project before you graduate from my school. And what I really liked about this class was that our teacher allowed us to use the same topic that we used for the first research course, and we can apply it to use it for the actual capstone. The only difference between those two classes was that for capstone, you actually had to go out in the field and present to the community. So because I did the elderly nutrition, I thought the perfect place was where I did my community clinical, which was at a community center for the elderly. And I just with myself and my group, we talked about the different topics and issues that revolve around elders and malnutrition, and we gave them like screening tools and stuff like that. So that class was pretty much time consuming again, because you still had to do the research. You had to create a plan. You had to meet up with your capstone advisor throughout the semester to figure out like if you're on track and stuff like that. So yeah, and that is pretty much it. I know this video was long, but I hope it was helpful. Overall, my true experience from my nursing school was that I felt like my school really prepared me well. There was some negatives about my school, which I'll talk about in another video. But overall, I think they really prepared me well for the school. Preparing for my NCLEX, I feel like some of the little things that they taught me, or the little stories I remember from like from like either the teachers telling me or what I learned in clinical is like coming up. But I really, really think that my school did a really good job of, giving us the material. I'm not going to say that it was easy, because it was definitely hard. Especially, I felt like it was harder for me because I was married and I had a child. I'm pretty sure it was the same thing even if you were single, because most of the single people in my class worked. So, I mean, stress is stress to different types of people. So, yeah. So that's pretty much it. If you guys have any other questions, I know this video is going to be long, so I'm probably going to split it into two. Thank you guys if you guys have watched part one, and probably this will be part two. I appreciate you guys for watching. If you guys have any questions or anything like that, you can leave them down below. If any of these classes that you have taken and you have tips yourself and you're in nursing school, leave them down below, and I'll talk to you guys later. Make sure you guys subscribe, thumbs up this video, and leave a comment, and I'll talk to you guys in the next one. Bye.